Good afternoon, everyone. My name is Kristen Wan, and I am with the Community Health and Prevention Team here at the Association of State and Territorial Health Officials. I would like to welcome you to today's Healthy Aging webinar, Physical Activity and Quality of Life, which is being co-sponsored by the National Physical Activity Society. ASTHO, with support from the HHS Office of Disease Prevention and Health Promotion, is working on this exciting project to improve the capacity of states to successfully implement healthy aging initiatives. This work naturally aligns with ASTHO's current President's Challenge to promote the health of older adults by collaborating across sectors, which we will learn more about this afternoon. The objectives of today's webinar are to 1. Highlight ASTHO's 2015 President's Challenge and examples of strategies states are using to promote active living among older adults. 2. To provide an overview of the relationship between physical activity and quality of life among older adults. And 3. To share resources that states can utilize to promote active lifestyles from the National Institute on Aging's Go for Life campaign. We have an esteemed panel of experts that will be speaking with you today. Following my introductions, all of the speakers will present their slides. If you have a question, you are welcome to post it in the chat box on your screen at any time during the webinar. These questions will be used during the Q&A after today's presentations. At the conclusion of the webinar, you will be directed to an evaluation survey. Please take minutes to inform us about the work you are doing to promote active living among older adults in your state and to provide us with feedback on today's webinar. We look forward to hearing about your efforts. Our first speaker is Dr. Jewel Mullen. As Commissioner of the Connecticut Department of Public Health, Dr. Mullen oversees the state's leading public health agency. Appointed to this position in December 2010, Dr. Mullen has combined clinical work, research, teaching, and administration throughout a career focused on improving the health of all people, especially the underserved. She is a leader in building effective community-based chronic disease prevention programs. She is committed to improving individual and population health by strengthening coordination between the public health and healthcare systems. She recognizes that efforts to improve the health of individuals and communities must be informed by an understanding of the social context which determines their behaviors and their access to resources. Dr. Mullen is ASTHO's current president and in September 2014 issued her President's Challenge, Healthy Aging, Living Longer Better. And with that, I will turn it over to Dr. Mullen.
Thank you, Kristen, and good afternoon, everyone. Thank you for being on this webinar with us. I feel privileged to have a moment to tell you about Living Longer Better, our ASTHO President's Challenge, which I will share with all of you. I refer to as core public health. And for the past year in planning and then implementing the challenge, we have founded our work on the framework of the National Prevention Strategy, which gives us so many foundations for supporting the health and well-being of older adults in their communities. And for today's presentation and talking about physical activity, we really are touching on all of the strategic directions in addition to many of the priorities of the prevention strategy, because we are talking about healthy and safe community environments in which older adults can be active. We, in enabling their activity and creating the environments, are supporting their empowerment. In supporting their health, we're also working towards a reduction in health disparities, and for many older adults who are also preventing and managing chronic conditions, the possibilities of community and clinical linkages that incorporate active living and healthy eating are also extremely important. So for the National Prevention Strategy framework, the President's Challenge has been one in which I have asked my counterpart state health officials and their teams within their agencies, because as Commissioner, I understand so much of what we accomplish is through supporting the programs and policies that program staff, managers are really leading. I've asked them to work with their teams inside their agencies, inside their states, and across their states with communities and local experts to build partnerships. The goal is to increase the number of older adults who are able to live and age well in their communities. And in December at our quarterly ASTHO State Health Official meeting, we provided shows with a number of evidence-based strategies, encouraging them to use the Community Guide for Preventive Services as a resource with which they could partner with others in their state to advance healthy aging. As I've already mentioned, we've touched on the 4 strategic directions of the prevention strategy, and certainly here in promotion of physical activity, in addition to active living, because as you'll see in my slides later, we also need to focus on injury prevention. I'll say a little bit more there. Thus far, we have had the pledges returned from actually now 33 state health officials representing 31 states and 2 of the U.S. territories who have identified a partner with whom they are advancing evidence-based strategies. And while there's no requirement, our hope is that by the official end of my presidency at the end of September, all of my counterparts will have signed on to the pledge, perhaps along with many of you as their partners. The National Prevention Strategies recommendations for active living include encouraging community design and developing, supporting physical activity that's conducive to older adults, promotion of community-based programs that encourage older adults to be active, and once again, facilitating accessible and safe and affordable places for older adults to be physically active. Some examples of the kind of work that states have already pledged to undertake and are implementing, and I should tell you that in an effort such as this President's Challenge, we also acknowledge that there has been a lot of excellent work ongoing in previous years that states are building on, and people aren't necessarily undertaking efforts de novo. Michigan has an enhanced fitness program, which is an evidence-based group physical activity program for older adults, looking at improving functional fitness as well as well-being. And as we hear some more later about Go for Life, we'll also see how this also meshes with some of the goals of Go for Life. So aerobic strength training, balance, and flexibility. And this is a program that is adaptable for people of different levels of function. In Kansas, they're implementing Personal Action to Health, PATH, which encourages good lifestyle decisions and provides positive experiences for implementation of healthy lifestyles. A component of that is exercise education, along with exercise and nutrition practical experience. In Kansas, they are measuring outcomes and performance evaluation, specifically the relationship between exercise and mental function. Arkansas has a peer exercise program that's promoting independence, PEPI. Once again, you see here the focus isn't just on moving, isn't necessarily on being strong or being an Ironman, but maintaining function through focusing on flexibility, balance, strength, and endurance. Participants learn safe exercise and correct exercise along with peers of similar ages and health conditions. These kinds of programs are being offered in their senior centers, churches, nursing homes, and doctor's offices. And through that array, you can also envision the numbers of partners that state and local health leads have established. Through the President's Challenge, we also have health officials who are addressing healthy and safe community environments along with their partners. There's been a lot of focus on caregiving, mental and emotional well-being, injury and violence-free living, and clinical and community preventive services. For more information on the President's Challenge, I encourage you to look at the website. web address is here on this slide. And to go with the reminder that as we talk about promoting physical activity for older adults, we're not talking necessarily about chronic disease or illness or disability or nursing homes or cognitive decline, all of which are themes that oftentimes come up in conversation around older adults. But we are really talking and reminding people a few things, one of which is that there's a spectrum of older adults over the age of 65 of multiple different functional levels, comorbidities, health, and people want to stay in their communities. So, leaving you with some reminders, I encourage you to think about the challenge and physical activity, remembering that even as we think about caregiver needs, we're thinking about people who will help older adults maintain physical activity. And when we're talking about healthy and safe community environments and venues for physical activity, please be mindful of transportation because transportation access for everyone, especially older adults, is especially important. And for some individuals, depending on where they live, they might actually need accessible transportation to get to a safe place in which to be physically active. And that as people want purpose, even after they finish their formal employment years, the ways in which they can be volunteers help them maintain their activity and contribution to society. As they continue to sometimes take on new or continue avocations that they've been engaged in. And that as they do that, and as we plan for older adults, to be mindful of having communities that are, we call age-friendly, with the notion of there being accessible and available and welcoming for older adults who can be integrated into the rest of the community in a life course way. Whether or not that be in an urban environment, a suburban environment, or out in parks and trails. And I'd just like to mention that as part of this initiative, we've also had great partnership from the National Parks Service. And then a few other reminders in terms of community design. Here in Connecticut and in many places, suburban design, oftentimes thinking about playgrounds for children, accessibility and venues for activity with a life course perspective can also incorporate playgrounds for older adults. And the basic reminders of complete streets, walkability in one's neighborhoods, and safety and what we can do at the state and local level to partner to ensure that design enables safe mobility for older adults. And then finally, because we spend so much time thinking about sports, youth concussions, and head injuries, the importance of safety and avoidance of head injuries for older adults is key. And it struck me in this picture in the upper left to see this older woman who looks like she's loving riding her bicycle out ahead of the pack, and she's the only one who's not protecting her head. So as we think about promoting physical activity, to do so in a way that upholds safety and minimizes the risk of injury is key. Finally, I used to remind my patients that if there was nothing else they could do to be active, to just get up and move, dance, don't be inhibited. And with that, I will close by saying one of the best ways to know how to promote the well-being and health of older adults is to hang out with them, talk with them, and hear what's important to them. And in these final slides, you see examples of how some other state health officials and I were privileged to do that with a group of seniors in an Aboriginal village in Taiwan a few years ago, where we did chair exercises, and we got up and danced with them and understood the purpose, meaning, and multiple health benefits of what they were doing in a congregate setting on a daily basis to stay active. So with that, I will conclude and happily listen to the other presentations, just again with this reminder that as we do plans to improve the health of older adults, let's remember to keep ourselves among them so that we are actually promoting things that are desired by them. Thank you for your attention.
Hey, thank you so much, Dr. Mullen, for that wonderful presentation and an overview of your challenge and vision. Our next speaker is Dr. Miriam Nelson. Dr. Nelson is Associate Dean of the Jonathan M. Tisch College Citizenship and Public Service and Professor of Nutrition at the Friedman School of Nutrition Science and Policy at Tufts University. For the past 12 years, Dr. Nelson was Director of the John Hancock Research Center on Physical Activity, Nutrition, and Obesity Prevention. In addition, Dr. Nelson has contributed broadly to public policy initiatives. In 2008, she served as the Vice Chair of the Physical Activity Guidelines Advisory Committee for the U.S. Department of Health and Human Services. She also served on the 2010 and 2015 respective Dietary Guidelines Advisory Committees for the U.S. Department of Health and Human Services and U.S. Department of Agriculture. With that, I will now turn it over to Dr. Nelson.
Thank you very much. I really appreciate being here today and listening to the previous presentation by Dr. Mullen and looking forward to hearing the final one. So I would like today to go over just a little bit about optimal aging and how active are we at different ages. I want to review the physical activity guidelines. As you heard, I vice chaired the 2008 physical activity guidelines, and I've also just come off the dietary guidelines where we have a new chapter on physical activity, and then talk about one of the experiences that I've been very involved in, and that's our Strong Women program, and sort of where do we go from here. So it's really important to remember that physical activity is important at all ages. I get asked a lot when I give talks around the country, so what age should I be starting to be physically active? And basically as soon as somebody can move, that's when they need to be physically active. But on the other hand, if I'm talking at an assisted living facility and there's an 87-year-old woman who asks, when should I start? Today's the perfect day to start. So at all ages. The woman on the far right here is Bernice. She was 93 when I started to work with her, and she could beat me in bowling handily. So at every age it's very important. The reality is that much of what we consider aging is really inactivity, and it's hard to really separate out the two. But one of the things that classically happens with people who are inactive and also with aging is a reduction in muscle mass, muscle strength, aerobic capacity, flexibility, bone density, and balance, with an increase in fat mass and glucose intolerance, depression, sleep problems, and increased risk for cardiovascular disease, etc. And what we now know from a lot of research that's been happening over the last 3 decades is that optimal aging is really what we're all after. And you can see right here from these slides, this is showing you another description of, here's a young active person on the left. This is a cross-section of a CT scan of a thigh. And you can see that muscle takes up about 90% of the area, whereas the older sedentary person on the right, and in fact these people have the same BMI, the muscle's only taking up about 45 or 50% of the area. Similarly, we can see that with bone, and the trabecular bone on the left is dense and strong, and the trabecular bone on the right is very osteoporotic. So just looking at muscle and bone, you can really see the difference. But optimal aging is really at any age, not underestimating your potential. It is making sure that you're putting in the supports that people can have around them. I love this photograph because the guys in the back are just looking at this woman and are just in disbelief. She's 86 years of age. And it's really important to make sure that we don't underestimate what older people are capable of doing. And I love this picture of John Turner at 67 with a body to die for. So it's really important to break through some of the myths of what aging is all about, and to realize that most people don't optimally age because they're not eating as well as they should be and they're not as physically active. But I want to show you a little bit of data on physical activity participation rates. So this is actually with girls and women, and this is looking at minutes per day with accelerometer data and it's nationally representative from NHANES data. And what you see is in girls 6 to 11 years of age, they're getting on average about a little over 70 minutes a day of physical activity throughout the day. But there is a huge drop-off in the teenage years. And then you can see with every bit of advancing age, the numbers are going down so that the 70 plus is getting less than 5 minutes. This is total activity throughout the day when people are up and around. So the older people are in the data is a little bit higher for men, but the trend is exactly the same. If we look at the percent of adolescents and adults and older adults that are meeting the physical activity guidelines, again using objective measures, because if you actually ask people from self-report how physically active they are, what you see is that people over-report how active they are. They actually under-report how much they eat. So this is objective with accelerometers. And we see that less than 5% of females are meeting the physical activity guidelines, and it keeps going down with each advancing age. And with men, it's less than 10% for the 16 to 19-year-olds and less than 5% for adults and older adults. So we have a long way to go for meeting the physical activity guidelines, which I'll get to in just a minute. So some sort of overall physical activity trends, and Dr. Mullen sort of went through, I think, some of this, and that's it. The trends are such that there's evidence that people on average are becoming a little bit more active in their sort of intentional or leisure time physical activity, which is a good thing, but it's very minimal. Activity for occupation, so this is actually manual labor and how we work. Our occupation has become more sedentary. The way that we transport ourselves has become more sedentary. How much activity we expend within the household has become less active. And then our sedentary time has become greater. So the balance is really that something somewhere went terribly wrong. And where we used to be very active, we are, regardless of the age group, we are very inactive. And some of that is we sit in cars all day, we ride people moving apparatus all the time, and it is important, especially for older adults, that we make sure that people with disabilities or mobility disability can get around, but we far more help people not to move than to be moving. And then the average family has the television on for over 4 hours a day at home, and for older adults, I believe that this number is even larger. And what we really need to be thinking about is really thinking about physical activity differently. And we need to be just getting people out and enjoying walking, getting them dancing, doing the activities that they really enjoy doing. So now I'd like to turn to just a couple of studies, some of the most recent studies, and sort of summary of some studies around aging and exercise. My early work actually in the 80s and 90s was around strength training and bone. And what we've seen is that, in fact, strength training is associated with higher bone density, and that strength training probably 2 to 3 times per week is associated with 1 to 2% gain in bone density, and that strength training can be performed both in center-based settings as well as home-based settings. In terms of balance training, which I think is some of the very exciting work that's going on with the elderly, is that balance training really does improve coordination and balance. And in fact, the human body, as it gets older, is very elastic and plastic and can really gain balance over time. And that balance training exercises reduce falls by about 30 to 40% in those individuals who are at risk for falls. And that balance training can also be performed both in the at a center-based setting and in home settings. Perhaps the largest study to date is the LIFE study, which has just been published. In the main findings were published in JAMA. I was a part of this, and it was a multi-center trial, which was a randomized controlled trial of moderate physical activity against a successful aging program. That was the control group. There were men and women who were all at risk for disability. The program was really walking, strength, and balance 3 times per week, starting in a center setting and then moving into the home setting. The goal for walking was 150 minutes per week, which is actually meeting the physical activity guidelines. And the setting was center-based and, as I said, transitioning to home. And the main outcomes were functional performance and mobility disability, really the ability to walk 400 meters. The average follow-up for this study was 2.6 years. The age group of the men and women was 70 to 89 years of age, and there were 118 individuals randomized to the physical activity group and 117 to the attention control group. And again, this was a multi-center trial that was all over the United States and supported by the National Institute on Aging. The data here, and I know it's a little hard to see these plots, but bear with me and let's look at the science here. But the overall findings from the 2.6 years of average follow-up was that incidence of major mobility disability, so this is the whether someone gets to a point where they cannot walk 400 meters, which is about a quarter of a mile and is thought to be a marker for being independent in somebody's home, is that the physical activity group, the incident was 30.1%, and in the controls it was 35.5%. And in fact, this was highly significant difference between the two groups. A lot of work is going into the life study right now in terms of the cost effectiveness and the mental health outcomes, but all of these data are in process right now. But this is very exciting data to show that older adults who are already at risk for mobility disability can reduce the incidence of major mobility disability with a program that can be done in a center that can transition into home. So now I'd like to turn to the physical activity guidelines for Americans. And I was lucky enough actually to go to the White House to release these with HHS and others in the fall of 2008. And you'll recognize a few people here, certainly in the center, but then on the right you'll see Michael Phelps. This was the Olympics from Beijing were also at the release of the guidelines and celebrating the Olympians, both the Special Olympics as well as the regular Olympics here. So I just want to go over all of the guidelines, just give you some context. So for children 6 to 17 years of age, the guideline is an hour or more physical activity that's a mixture of moderate to vigorous every day of the week. So it's a daily requirement. For adults 18 to 64 years of age, the minimum level a week to gain benefit is 150 minutes of moderate intensity activity, aerobic activity, or 75 minutes of vigorous intensity activity, or a combination of the two. And this is over the week, not a daily requirement. Muscle strengthening activities that involve all major muscle groups should be performed on 2 or more days of the week. So strength training 2 or more days of the week. It's okay if the days are consecutive. It doesn't matter. For additional benefits, 300 minutes a week of moderate intensity activity or 150 minutes of vigorous activity or a combination of the two adds additional benefits. For older adults, 65 years and older, the great news here is that they should be following the regular physical activity guidelines for adults. But when not possible, they should be as physically active as their abilities and conditions will allow. And that for those who are at risk for falling, they should be participating in balance exercises. Those without chronic conditions and symptoms such as chest pain or dizziness or joint pain do not need to consult a healthcare provider about physical activity. In the old days, it used to be that we would say as health professionals, oh, you're older adult, before you become active, you need to get a doctor's checkoff or permission to do this. And in fact, when we were putting the guidelines together, we felt that there was more evidence that if an older adult wanted to be sedentary, they needed permission from their doctor because it's far more risky to be sedentary than to be active. But the reality is that people are fairly healthy. They can get out and start walking. We do encourage all older adults, of course, to have a healthcare provider that knows them well that can help troubleshoot for them. So overall, when we're talking about the optimal prescription for older adults, we're talking about aerobic activity, strength training, and balance exercise. And the balance exercises are for people who are at risk for falls. really helps to increase health and longevity. The evidence is very much there. I do want to make a little bit of a note about flexibility. You'll notice that flexibility is not here. And when we looked at the evidence for flexibility in the 2008 physical activity guidelines, there is evidence, but there is evidence actually that flexibility does not seem to have a big role to play. We do think it's important for a warm-up and cool-down, and it's a nice way to get older adults started on a program, but flexibility by itself does not seem to help with any health benefits nearly to the same extent as aerobic activity, strength training, and balance training. Some of the big findings are that regular physical activity reduces the risk of most chronic diseases, that some activity is better than none, that added health benefits occur as amount of activity increases, and that both aerobic and muscle strengthening activities are beneficial. The health benefits apply to people of all types, sizes, and ages, that they occur for people with disabilities, that the physical activity can be done safely and that the benefits far outweigh the risks, and that physical activity provides health benefits regardless of body weight changes over time. Some key messages are that any activity is better than none. You can accumulate in small or large bouts over the week. It's great news for people who are very busy, and that it's a weekly accumulation, not a daily accumulation. Walking is great, benefits for any body weight, and it's really important that people know that there's many different types of activities they can choose to be physically active. I encourage you to go to fitness.gov where there's a lot of information for this around physical activity and the guidelines. And the important thing here is really to be active your way and to be active, healthy, and to be happy. I want to spend just like 3 or 4 minutes talking about our Strong Women program, which is a national program that we run out of Tufts University here. And this came out of my Strong Women books that I published about a decade ago that highlighted the importance of physical activity, especially strength training and aerobic activity for older women. This is a group up in Soldotna, Alaska, an amazing group. We have a big national program, and one of our strongest programs is in Alaska. So this project has been done in collaboration with the USDA, especially Cooperative Extension, with support from the Centers for Disease Control. And at strongwomen.org, which is a site we run out of Tufts, we have a lot more information. But the goal here with our program is to really change knowledge, to change access to programming, ultimately to change behavior of these women, and then to have societal change, because we believe in the mantra, really, change yourself, change the world, that when we change behaviors and knowledge of these women, that they are really huge, they set societal norms within their communities. And a lot of our work has been done in rural communities. This group on the left is from Choteau, Montana, a wonderful group where we have a big program. And we have 3 different curricula. We have strength training, a healthy hearts curricula, where we've done a national training that's both nutrition and aerobic exercise, and then we have something we call change clubs, which is about bringing women together to create sustainable environmental change within their communities around nutrition and physical activity. Here's a sense of where our programs are in blue, and our largest programs are in Alaska, Montana, Kansas, Colorado, Arkansas, Missouri, Wisconsin, and Pennsylvania. One of the things that we've seen, and I'm sure all of you have seen this as well, and that is that sort of when we think about training older adults and we think about programming, if older adults are healthy and they're independent, the programs really can be self-directed, can be group training, or really use a public health model to reach large groups, and we can think about transportation and the built environment. But the older somebody gets, or the more infirmed or unhealthy, or if they have mobility disability, that's when we need a greater level of training, sort of specificity and one-on-one training. And we've done, with my colleagues, we've done a number of projects, research studies in nursing homes and long-term care facilities. And much of the time with folks that are in these facilities, they need one-on-one training, and we really need to be cognizant and careful about the customization of the program, and managing setbacks is really critical to keep people physically active. I certainly think of my own mom and dad who are 87 and still very active, but sometimes things happen and they need to recalibrate their training program to keep going. But it's important to realize that the level of supervision is different for older adults depending on the spectrum of their needs and how healthy and active they already are. So where do we go from here? Well, that will be the next presentation. After me for Go for Life, you're going to hear some programming. But I do think that we shouldn't be thinking that we're lost in the wilderness here, but that there is a lot of programming that's out there that's accessible, that's low cost. And I think that older adults these days are really hungering to be physically active, and they're really changing the paradigm of what it means to grow healthy and healthy. So is it worth the effort? Yes, I'd say that for older adults, they have the most to gain by being active and enjoying life to its fullest. So thank you very much, and I'm going to hand it over to the next presenter. Thank you.
Thank you, Dr. Nelson, for that very informative presentation. It really does, set the stage and provide some background for moving into the next presentation. I just wanted to remind our participants, if you have any questions for our presenters, feel free to submit them through the chat box, and we'll also be opening up the lines after this final presentation. So with that, I will introduce our final speaker, who is Karen Posinki. Karen leads the Professional Education and Health Communications Group in the Office of Communications and Public Liaison of the National Institute on Aging at NIH. She is responsible for creating, developing, promoting, and evaluating an award-winning program of scientifically accurate, audience-appropriate health education initiatives for older Americans. Ms. Posinki directs Go for Life, the federal government's evidence-based exercise and physical activity campaign designed especially for people 50 and older, which you will hear more about in today's presentation. In addition, Ms. Posinki oversees NIA Alzheimer's Disease Education and Referral Center and coordinates NIA's participation in NIH Senior Health, an award-winning website developed in collaboration with the National Library of Medicine at NIH. And I will now turn it over to Karen.
Thank you, Kristen, and thank you for the opportunity to speak this afternoon about Go for Life, which is the exercise and physical activity campaign for older adults from the National Institute on Aging at NIH. NIA has been supporting research into the health benefits of exercise for older adults for some time, and that research was first translated for the public into an exercise guide with the help of a panel of experts in exercise physiology, geriatricians, behavioral scientists who looked at the evidence to say that exercise is not only important for older adults, but it's also safe for them to do. That original guide has over time become a more comprehensive health education campaign that is now called Go for Life. And the goal of Go for Life is to encourage and to empower sedentary older adults to make exercise and physical activity part of their daily lives. We offer sample exercises, motivational tips, success stories, online virtual coaches, tracking tools, and other practical tips to help people get ready, start exercising, and keep going. And as I mentioned, the campaign is evidence-based, based on some of the work that Dr. Nelson has talked about this afternoon, showing the health benefits of exercise and physical activity for older adults, even those who have chronic health conditions. Go for Life is unique in that it's reaching out to older adults who traditionally haven't embraced exercise and is showing them that even those who have physical limitations can exercise safely. This is a sample page from the Go for Life website, and it shows the type of information that we provide, from general information about the various health benefits and real-life benefits of exercise, to tools that can help individuals determine their current fitness level and set both their short-term and long-term fitness goals, to actual sample exercises for people to try. We offer exercises in 4 domains, including endurance, strength training, balance exercises, and flexibility. And this is a sample strength exercise, and you can see that it has detailed instructions on how to do the exercise correctly. There are tips for progressing so that you can challenge yourself to do more over time. And then there's some information about any equipment that you might need to perform the exercise, such as hand weights in this particular example. We have worked with our researchers studying behavior change to create our online virtual coaches. Max is one and Tina is the other. And you might guess from the photo that Max is our drill sergeant and Tina is our cheerleader. And you can sign up to receive motivational tips or messages by email, either once a week or once a month from your coach Max or your coach Tina. And they will send you tips on nutrition, on exercising safely, on sample exercises to try, motivational information, and more. We also have printable tools on the website so that you can find your fitness starting point, you can set some goals, you can make a plan that you can print out and put on your refrigerator so that you can check on yourself, and then there are progress tests so that you can measure your fitness over time, see how you're doing. We now have more than 80 tip sheets on Go for Life website. And these you can read online or you can download and print them, distribute them. And they are on a variety of topics. Under the activities and general fitness category, we have things like be active with your dog, work out with your grandchildren, exercises to do while you're working or while you're on vacation. Under health benefits of exercise, we have information about exercise for people who have arthritis or diabetes, osteoporosis, Alzheimer's disease. There is a variety of safety information, things like biking safety or walking safely in cities or in urban areas, exercising safely in very hot weather or very cold weather. We have nutrition information because we think good nutrition and exercise go together. So we have material on maintaining a healthy weight or making smart food choices or healthy snacking. The tracking tools I've mentioned, motivational tips, we have information about how you start over to exercise if you've had a break. For example, if you've had an illness or an injury or you've been on vacation and you need a little kickstart to start over again. And then how you can fit exercise into a busy day. And the exercise guide and many of our tip sheets have been translated into Spanish, so that information is also on the website. We have more free stuff available. Workout to Go is a sample exercise routine that we have put together from the various exercises on the website. And this little booklet can go anywhere in your purse or in your suitcase. It's easy to do anytime, anywhere. We have posters, we have bookmarks, and there's a lot of free information, free materials that people can order. We realize that it's really an enormous challenge to encourage and enable older adults to be more active, and we know we can't do it alone. And that is why we're working with public and private organizations such as ASTHO to help carry the public health messages out into the community. And right now we have more than 150 Go for Life partners who are working with us in a variety of ways. And we're very excited about the first ever Go for Life month, which is coming up in September. And this is being sponsored with us and the White House Conference on Aging. And we're hoping that all of our Go for Life partner organizations will participate by holding an event or sponsoring local activity or promoting exercise and physical activity in some way to their members or their constituents. And the theme for this year's Go for Life month is Be Active Every Day. And to help our partners plan activities and conduct activities during Go for Life month, we have developed a number of tools that are on the website. So we have some background information about what the month is all about. There's an event planning guide. We've put together some social media tip sheets and messages, some media materials. So we've done a feature story and a media alert, some sample newsletter articles that people can use and customize for themselves. And then a list of free materials that you can order for an event or an activity. And we've even put together a little selfie activity so that if you're having an event, you can have folks fill in the blank and take a picture with their phone or the old-fashioned way with their camera, and they can share those on social media. And we're really hoping that everyone will join with us in September to promote exercise and physical activity to older Americans. We're here to help. We're here for the long haul, so if you make it for September, that's great. If you don't make it and you want to keep going after September, that's great too. We're taking information about people's events so that we can post that on the website and everybody can see what other organizations are doing. And I hope that if you have any questions or need more information that you'll let me know, and you can contact me through goforlife@nia.nih.gov. Thank you.
Great. Thank you, Karen, for sharing the resources that you've developed. And I know this will be really helpful to states as they're planning activities related to healthy aging. We will now conduct the Q&A session. If you would like to ask a question, please type it into the chat box located on your screen, or you can press *1 to have the operator unmute your line. And while we're waiting for some questions to come in, I have one question for Dr. Mullen and maybe Dr. Nelson as well. What suggestions do you have for engaging key stakeholders from other sectors in the promotion of physical activity for older adults?
This is Mim Nelson. I think a great example of all the different sectors coming together is the National Physical Activity Plan. And I would encourage the people that are on this webinar to take a look at the National Physical Activity Plan, because it's looking, we do need to partner with transportation, parks and recreation, healthcare, with entertainment, with housing, and all the different sectors really need to be involved, because while we will get a few people to really take the initiative to start an exercise program, I think getting people to participate in active transport and make their communities safer and more active, that'll make a huge difference. So it's just really, really important. But Dr. Mullen, I'm sure, has something to say as well.
I'm just going to add to what you just started, and because it gets to the spirit of the President's Challenge, Living Longer Better. So one important thing is to recognize there are lots of people out there doing something, and we don't all know what one another are doing. So public health, I remind people in state public health agencies sometimes, since we don't oversee aging services, that we can be very good conveners for others who are looking for partners. So we can help people network with one another. But the other point, building on what Dr. Nelson just said, is that we need folks to think even more expansively into all the domains of community living for older adults, and what that means, because there's oftentimes such a disease focus on aging, even when we're talking about healthy aging, that a logical starting point for many people is addressing fall risk, and their physical activity programs rightfully start with Tai Chi, balance kinds of programs, which are really, really key. But as we've just seen from science and practice, that's just one piece of what people need to do. So even working with those who are funded to or have decided to promote some of those type balance programs to get the broader conversation about what else is going on in their communities, to help people be active, increase their endurance, increase their strength, and if nothing else, feel good increasing their flexibility. I think that'll help.
You know, and there are some questions here. This is Dr. Nelson again, and I'm happy to let my co-presenters answer some of the specifics. But one of the things that we really need to do is to change the culture of health in this country so that being physical activity is just naturally what everybody does. And so that's why you can't just come up with one solution for everybody. We really need to sort of change the whole different way that we talk about this and think about physical activity, and it's at all generations. And I think when we think about the older adult, they're very specific, but we do need to think of this as being intergenerational.
Great. Thank you so much, Dr. Nelson and Dr. Mullen. Just wanted to ask the operator if any questions have come in over the phone.
There are no audio questions.
Okay, great. So we've had a couple of other questions come in through the chat box. So are any of the presenters aware of grants for local governments to implement physical activity for older adults at the community or population level?
There have been grants to localities in both states and cities that were funded for community transformation grant programs, where municipalities did adopt and implement physical activity programs, sometimes in an intergenerational way. And even though that funding opportunity has now concluded, a number of communities in Connecticut, and I imagine in other parts of the country, are using federal funds through the Prevention and Public Health Services Block Grant for implementation of physical activity programs. The last thing that I'll say so that my co-presenters can also answer is that many state agencies on aging also receive federal funds, and some have state funds to support programs at the local level, either through towns, through senior centers.
Great. Thanks, Dr. Mullen. Did any of the other presenters have anything to add to that, or are you aware of any other funding available?
Karen, I think that the Administration for Community Living would be the federal agency that might have such funding, and I'm not familiar with all of their programs, but that would be the place that I would suggest folks contact.
Thank you. Okay, and then there's another question here in the chat box. What is one of the best ways to ensure that the individuals instructing or implementing these physical activity programs are qualified and capable? I don't know if Dr. Nelson.
Sure, yeah, I'm happy. I would really hope that depending on the level of frailty of the older adult, that the individuals who are running the programs either have a certification through the American College of Sports Medicine or the National Strength and Conditioning Association, has a sort of a national certification if they're leading a program. I think that's very important because then they have the knowledge on how a program may need to be tweaked for optimal results. And then, the other is to make sure that older adults can just go out and take a walk, or do their own physical activity. They don't always have to have instruction, although it would be nice. But I don't want that to be a impediment to get them going.
Great, thank you. And then we have a couple of questions for Karen related to Go for Life. What kinds of activities are groups planning for Go for Life Month? You mentioned that you've been receiving some submissions for activities that groups are planning. Can you describe some of those for the audience?
We've had a number of activities that are in the works. from intergenerational activities, we have one group that's going to do an intergenerational activity in a senior living facility where they're going to do relay races with the older resident and a family member. There are a number of groups that are doing Go for Life classes where they're going to be holding exercise classes or events in their facilities. We have some that are just going to send out information about exercise and physical activity in their newsletters and in their communications with their constituents and putting information up on their website. So it really runs the gamut.
Okay, thanks. And just before we wrap up, I just want to check with the operator one last time to see if any questions came in through the phone line.
There are no audio questions.
Okay, great. So with that, we will end the Q&A portion of the webinar. And I want to thank everyone for joining us today. As was mentioned earlier, you will be immediately directed to an evaluation survey at the conclusion of today's webinar. Please take a few minutes to complete our survey as it provides us with useful information for our future projects. It also has questions related to the work you are doing to promote active living among older adults in your state. I would like to thank the National Physical Activity Society and the Office of Disease Prevention and Health Promotion for co-sponsoring and supporting this webinar. And I would also like to thank our speakers, Dr. Jewel Mullins, Dr. Miriam Nelson, and Karen Posinki. A recording of today's webinar will be available on our website within the next few days. We hope that you will use this webinar as a resource and will share the link with others once it is available. Also, please visit ASTHO's website to learn more about ASTHO's 2015 President's Challenge on Healthy Aging, Living Longer Better Across All Sectors. In addition, in case you have not heard, registration for the 2015 Healthy Aging Summit is now open. This event will take place in Washington, D.C. from July 27th to 28th. The summit will focus on the state of the science and prevention to help Americans sustain optimal health before entry into the healthcare system. More information can be found by visiting www.2015healthyagingsummit.com. If you have any follow-up questions about today's webinar, please feel free to contact me, Kristen Wan, at kwan@astho.org. Thank you and enjoy the rest of your day.